Do you want to last longer in bed? I'm Dr. Rena Malik, urologist and pelvic surgeon, and welcome back to the Rena Malik MD podcast, your source for evidence-based information about your sexual health and more. I'm committed to bringing you the latest and most comprehensive insights about urology and sexual wellness. Whether you're someone who's curious about health and wellness or looking for in-depth discussions about your health issues, you've come to the right place. Today, we're diving into the topic of premature ejaculation. And in this topic, I'm going to cover how ejaculation works, what causes premature ejaculation, how it's diagnosed, and the various treatment options available, including lifestyle changes as well as medical interventions. Premature ejaculation, or ejaculating before you want to during sex or even during masturbation, is very, very common. In fact, it occurs in about 30% of men, and actually only 9% of them end up going to the doctor because clearly this is a very stigmatized area. Let's start off by understanding the process of ejaculation. Ejaculation is a lot more complex than you might think, so let's break it down. It actually involves a reflex arc that kicks in at the height of sexual stimulation. So what happens is you get sensory signals from your genitals that get sent up through your spinal cord and to your brain. When you get to a high enough level of arousal, this then sends signals that triggers the spinal ejaculation center in the spinal cord. And once that's triggered, ejaculation is divided into two phases: emission and expulsion. Now, during emission, the tubes that carry sperm, including the vas deferens and other structures like the seminal vesicles and the prostate, start contracting or squeezing. This contraction moves fluid that will eventually form the semen through into the urethra at the base of the penis. Once the fluid is there, you can't stop. It's like the point of no return. And you might actually sort of recognize this feeling because it's like impending. It basically becomes involuntary to ejaculate. This then leads you to the expulsion phase. During the expulsion phase, there's rhythmic contractions of the pelvic floor muscles, which are essentially the muscles around the urethra and in the pelvic floor that cause the semen to propel out. And this is why ejaculation can be very powerful. Now, in a younger guy, that can be released with some force, anywhere between 30 to 60 centimeters per second. However, as men age, those muscles get weaker, right? And so the ejaculation becomes less forceful to even half of what it used to be. Or some guys will describe it as dribbling out. This is a normal process, and part of it is because of those weakened muscles. What I want you to take away is that ejaculation is partially a reflex. So once it gets into that emission phase, you can't go backwards. And so this could sort of destigmatize the idea that premature ejaculation is something you can just control through willpower alone, because a lot of guys can't. And that's not abnormal. This is a truly physiologic problem. Now, what happens to cause it though, right? As I mentioned before, it's a very common issue, which is estimated to affect about 30% of men, meaning if you have a room of 10 guys, 3 of them are going to be suffering from premature ejaculation. However, only 9% will actually go see a doctor for it. So what causes it, right? Is it just psychological, or are there also physical factors? And if you're listening, you already know that I'm going to tell you there's more than just it going on in your head. First of all, it's important to identify premature ejaculation as primary or secondary. Primary is that you've had this issue lifelong, which means that ejaculation occurs usually within 1 to 2 minutes of penetration, and you've had it your whole life starting at your first sexual encounter. Now, secondary is that something happens after you've previously had normal ejaculatory function. Obviously, there are psychological factors that play a role. I tell guys that no matter what, when you have a sexual problem, it's always up in your head to some degree, because the first time you have a problem, you're thinking about it. And the next time you go to have sex, it's still there. You're still thinking about it. And even when you start to have sex, like, oh my God, am I going to ejaculate too soon? Is my partner going to be pleased? Am I going to be embarrassed? You're always thinking about it. And it leads to psychological issues when you're trying to have sex that can make sex less fun, fun, less pleasurable, and more stressful. But there are a physical or physiologic component, and that is an imbalance in neurotransmitters or chemical messengers in your brain. Studies suggest that serotonin, which is a key neurotransmitter, plays a significant role. There might also be a genetic component. So if premature ejaculation runs in your family, you might be more prone to it. However, it's not really typical dinner conversation that comes up with your dad or your brother, right? It is usually something that is not often talked about. Another thing is hormonal imbalances. So particularly when we see issues with testosterone, they can affect ejaculation, and even thyroid issues have been linked to premature ejaculation. And lastly, some people have a high sensitivity of the head of their penis or the glands of their penis, and this can cause issues. Now, the last one is something that I do see quite often, and this is because when men start to have trouble with erections, they might not find themselves being able to last as long. They tend to then rush through sex because they're worried about losing their erection. So they're rushing because they don't want to lose their erection, and then they ejaculate sooner. And then their brain creates a circuit, right? They now think that that's as long as they want to last during sex. And so the next time they have sex, they have premature ejaculation. Your body then becomes habituated to getting to that specific point of arousal and ejaculating faster than before. Now, the good news is in these cases, when you fix the erectile dysfunction, you can oftentimes also correct the premature ejaculation. Now, next up, how is premature ejaculation diagnosed? Now, interestingly, it's not about going through a number of invasive tests or exams. It really just involves talking to your doctor so we can understand what your symptoms are. When are they happening? How often are they happening? And what have you noticed causes it to be better or worse? And how long has it been going on? Based on the guidelines, there are some criteria which we tend to follow. First, the ejaculation has to occur within 1 to 2 minutes of vaginal penetration consistently. Secondly, there must be distress associated with this, meaning you and your partner or you or your partner are going to be bothered by this. It might be causing stress or anxiety or relationship issues. And lastly, it should be a recurrent issue that occurs almost every time you have sex. Now, for me personally, I don't really care if you last 1 to 2 minutes or a little more than that. What I care is how bothered you are, because that's what really matters to me. I want you and your partner to be satisfied. Now, on occasion, I will say I've had patients come in and tell me they last 7 to 10 minutes, but their partner isn't satisfied. Now, if you guys are new here, let me educate you. The average time to ejaculation for men is somewhere between 5 to 6 minutes. So if you are already at that point, or even longer than that point, it's probably unrealistic to think that you're going to actually be able to double your time or last for 15, 20 minutes if that's never been the case. And so we have to sort of have a reality check in some cases and then talk about well, why does your partner maybe feel that way? What can we do to make everyone feel good and enjoy pleasure during sex? Now, we're obviously going to rule out any underlying conditions, specifically those hormonal imbalances we talked about, or if we think there's other health issues going on. So specifically, we might check blood tests like testosterone, thyroid function, and we may discuss your mental health and see if there's other factors at play that might benefit from seeing a sex therapist or a psychologist to deal with some of the anxiety and relationship factors that are at play. Now, what can you do? Right? There's a lot of ways that we can treat and manage premature ejaculation. And probably the most effective ways are doing lifestyle changes and sometimes adding pharmacologic therapy. So first up, let's talk about exercise. There's actually evidence that regular physical activity, particularly high intensity interval training, can help men gain better control over ejaculation. Now, this is because it improves cardiovascular health, which means there's better blood flow, which means better sexual function and overall stamina. But HIIT itself also boosts what we call interoceptive awareness. Now, this is your body's ability to recognize and sort of process internal signals. Think of it like you're becoming more in tune with what's going on inside. So things like HIIT, even yoga and running can help you sort of increase this awareness and help you recognize when you're approaching orgasm so that you can manage it more effectively. The other way this works is it helps balance the sympathetic and parasympathetic nervous systems. These symptoms are the ones that sort of manage stress and relaxation. So when you have a more balanced nervous system, meaning you can activate the parasympathetic nervous system, you can delay the ejaculatory reflex, which allows you to have more control. And of course, exercise reduces stress. It obviously releases endorphins, which are essentially body's natural mood boosters. And that is so important because, as I mentioned, stress can be a very vicious cycle when it comes to sexual dysfunction. And so anything you can do that will reduce stress, whether it's exercise, meditation, mindfulness, that can help. Now, to give you some data, a randomized controlled trial with 76 Chinese men who were between the ages of 18 to 34 looked at HIIT and how it affected premature ejaculation. These men got put into 3 groups, and one of the groups did HIIT for 7 minutes a day. Another group did slow breathing exercises for 7 minutes a day, and the control group. And the study found that 2 weeks of daily 7-minute high-intensity interval training led to significant reductions in premature ejaculation symptoms compared to the other groups. Now, in terms of yoga, they did a meta-analysis, and they found that, generally speaking, yoga programs increased intravaginal ejaculatory latency, meaning the time to ejaculation after penetration. In one of the studies, they found that this latency period before ejaculation went from 30 seconds to lasting nearly 2 minutes. While that doesn't seem like a lot, that's about a 4 times increase in time. And one of the studies said that the yoga was almost as effective as the antidepressant medications that we use to treat premature ejaculation. Now, it's important to remember these studies are relatively small, but they're promising, and these are really safe, easy things you can do at home. Lastly, pelvic floor exercises. Now, these exercises tend to strengthen the pelvic floor muscles and have been shown to potentially help with premature ejaculation. Several studies suggest these exercises can help men gain better control, and this is because they strengthen the pelvic floor muscles. So men can then delay ejaculation by consciously controlling those contractions during sexual activity. And of course, these muscles can also help with that awareness of where that impending arousal is going. And of course, like exercise, Kegel exercises alone can boost blood flow to the pelvic region, which will ultimately support your pelvic health and overall function. Next up are behavioral techniques. So one is the start-stop method. Now, this is simple, super easy, that you and your partner can practice, or you can practice by yourself. Now, do not surprise your partner with this. You want to talk about it before you have sex so that you're both on board. The concept here is to train your body to delay the point of ejaculation through controlled stimulation. And here's how it works. You want to start by, of course, beginning stimulation like you normally would. So engage in sexual activity until you feel like you're approaching climax. Just before that point of no return, stop everything and take a few minutes to let your arousal come down. This pause will help you sort of identify and gauge where you are in terms of arousal, and it trains your mind and body to respond differently to those sensations. I generally recommend taking some sort of deep cleansing breaths because those can help activate the parasympathetic nervous system. Now, once you've calmed down, then you start again. And generally, I tell people to do this 3 times, and on the 4th time, you let yourself ejaculate. And over time, this can increase the time to ejaculation. Another technique is sort of a variation on this. It's called the squeeze technique. So instead of pausing when you reach that point of no return, you're actually applying pressure to a particular part of the penis to help delay ejaculation. At that point, you want to firmly but gently squeeze the head of the penis, particularly the base of the head of the penis, using your thumb and your forefinger, and squeeze for about 10 to 20 seconds. That's just enough to reduce the erection rigidity just a little bit and diminish the urge to ejaculate. You then pause and then wait till your arousal level comes down a bit, and then you again restart. Now, these exercises can be sort of challenging if your partner's not on the same page because it can be frustrating. So you want to make sure you talk about it or you practice on your own. So interestingly, there's actually been some really interesting research on using masturbation devices combined with these techniques to help. And that's basically because they're providing a controlled environment to practice these techniques. And they may also provide some degree of desensitization because some of them include vibration and other factors. They're generally designed to just mimic the sensations of sex so that it makes it easier to then translate the skills that you learned during masturbation to a partner. So there's a couple that have actually been studied. And so the first one is called MyHixel. And this is a masturbator bladder type technology that's designed to mimic the vaginal environment. It also tries to maintain the temperature at 36 to 37 degrees Celsius, which is body temperature, and it has these gentle vibrations. So they published one study where they looked at 40 men over an 8-week program, and they showed a significant improvement in that intra-ejaculatory latency time from about 1 minute to a little bit over 4 minutes. And they compared this to guys who were just doing exercise without the masturbator, and that group only went up to a little less than 3 minutes. So it was significantly better. So the next device is called the Tenga Flip Hole. Now this is, again, a masturbation aid, and it was studied in a series of 18 men who had lifelong PE. It was studied in a smaller case series of about 18 men who used the device for 6 weeks for 5 minutes, 5 times a week. And while they didn't actually measure the latency time, 83% showed improvements in ejaculatory control, 72% had less distress, and only a third of people were satisfied with intercourse, but it did show some improvement. Again, really small study here, but interesting. Last one is also by Tenga. It's called the Men's Training Cup Keep Training. So it comes with 5 disposable cups that have 5 levels of tightness and strength. That ranges from mild to strong. So they did a study of 37 men that showed a significant increase of this ejaculatory latency from 103 seconds or 1.5 minutes to nearly 4 minutes after 8 weeks of use. Now, it is important to note that 18 of those men actually withdrew from the study. So some people left, maybe they didn't like it, maybe it didn't work. We don't know why they withdrew necessarily, but it's, again, all really small studies, but I do think there is value in being able to practice and potentially using a device that's like a masturbator that feels like a vagina and sort of mimics the vaginal environment is going to be better than masturbating with your hand, which really cannot mimic the inside of a vagina or the temperature of the sensations. So what if, you've tried all these things and lifestyle changes aren't working? That's where medications come in. Now, there are no FDA-approved medications for premature ejaculation. However, there are some that are pretty effective in terms of treating premature ejaculation. First up is topical anesthetics. Now, these are lidocaine-based creams or sprays that are applied to the penis 30 minutes to a few minutes before intercourse. And these are popular because they're easy to use. You can get them over the counter and they're pretty straightforward. Essentially, they're reducing the sensitivity at the head of the penis, the glans penis, which can help then delay ejaculation. Now, the benefits of these are they're quick to apply, they're easily accessible, and they're generally effective. Now, the downsides are that some people will actually have numbness, right? And this can then reduce the sensitivity of the penis, leading to issues actually maintaining erections. Also, if they're not washed off before sex, sometimes you can actually transfer them to your partner and they can experience numbness. Next up is antidepressants. So antidepressants work on serotonin. So specific antidepressants called selective serotonin reuptake inhibitors like fluoxetine, paroxetine, or sertraline. Certain antidepressants, which are selective serotonin reuptake inhibitors, things you've heard of like fluoxetine, paroxetine, or sertraline, or like Cymbalta, Paxil. These are effective at delaying ejaculation as a side effect. They're typically taken daily, and they do need a few weeks to take full effect. Now, they do have side effects, of course. They can cause some decreased libido in some. They can cause nausea and fatigue. And if you stop using them, sometimes the symptoms can come back. Now, there is an available option that you can take on demand called duloxetine, but that's not available in the United States. But it is sort of helpful if you can get access to it for men who are having premature ejaculation, so you can take it as needed. Last up are PDE5 inhibitors. Now, these are used for those specific subset of guys who are having premature ejaculation because they're rushing through sex and worried about their erections. Because if we can fix the erectile dysfunction, oftentimes we can help the premature ejaculation. This is why it's really important when you talk to your doctor to be very clear about what's going on with you. A lot of times, guys will come in and they say, I have issues with erections. They don't really go into much more detail. The doctor may not ask, and so they go home with a medication like tadalafil or sildenafil, and they don't see effect because it's not going to treat premature ejaculation on its own. It's only going to treat those guys who have erectile dysfunction and suffer from premature ejaculation as a result of that erectile dysfunction. Now, these medications are not without side effects. I've talked about these medications a lot on my YouTube channel, so make sure to check out the videos where we discuss those. If you're watching or if you're listening, make sure to go on YouTube and can watch those. But side effects can include things like headache, flushing, upset stomach. And these medications require that you have some sexual stimulation for them to work. And some require you to not eat before you use them so that you can have the most efficacy. So there are some sort of trade-offs when you're using these medications, but they are very effective for treating erectile dysfunction. Now, if none of these things work, there are some additional medications that have also been studied off-label to help. Things like tamsulosin or tramadol can help with premature ejaculation, but generally speaking, we try these other options first. And if you can do lifestyle options like we talked about, combined with medications, that's going to give you the best results. But always remember, there is no one size fits all solution, right? This is a very individual problem, particularly if it's not been lifelong, if it's acquired. There's a lot of things going on that you might need to address and look into. And so it's really important to do an audit, see what is going on, what changed, why all of a sudden are you noticing this change? Has stress at work increased? Has your relationship gotten more stressful? Have other things been sort of off that might be contributing? And how can we fix those as well while we're fixing these other issues? To wrap up, let me just summarize what we've gone through today. So premature ejaculation is really common, affecting up to 30% of men. 30% at some point in their lives. And it can be caused by both psychological, physiological, and genetic factors. It's diagnosed primarily by a discussion, right? There's not a lot of invasive tests that need to be done. It's most often by a discussion with your healthcare provider. There are a whole host of treatment options available, including lifestyle changes like exercise, stress management, and stop and start treatments, as well as using masturbator devices to help practice those things. You can also use pharmacological therapies like antidepressants or even topical anesthetics like delay sprays or creams to help with sort of decreasing the sensitivity. All right, guys, thank you so much for joining me today on today's episode of the Rena Malik MD podcast. If you guys enjoyed it, do me a solid favor. Subscribe or follow the podcast, leave a rating or review, and share this episode with someone who might benefit from it. Your support helps us reach more people with meaningful information. So until next time, take care of yourself because you are worth it.